everyone, and welcome back to my YouTube channel where we explore natural approaches to health and well being. So, today I want to address a common yet challenging skin condition. So, yes, I'm talking about perioral dermatitis, which is characterized by redness, rashes, and bumps around the mouth and nose. And perioral dermatitis can be frustrating to manage. But fear not, because homeopathy offers gentle and effective solutions to alleviate symptoms and restore skin health. So let's dive in. So before we discuss the treatment, that is homeopathic treatment, let's briefly understand what is perioral dermatitis. Okay, so let's talk about it. So perioral dermatitis is an inflammatory rash involving the skin around your mouth. The rash may be spread up to your nose and even your eyes, in which cases it's referred to as. So, perioral dermatitis usually appears on the light skin as a scaly and red bumpy rash, and on skin of color, the lesions may be hyperpigmented or brown in color. The bumps may contain fluid, which means pustules. So, there may be a clear fluid discharge from the bumps. Slight itching and burning can also occur. The condition is most common in females between the age of 20 and 45, but it can also occur in all ages, races, and ethnicities. And perioral dermatitis can occur in children at any age. And episodes of perioral dermatitis can last weeks or even months. And perioral dermatitis is often chronic and relapsing, but it may resolve after the triggers were removed. Triggers are removed. So this is the exact meaning of perioral dermatitis. I hope this is clear to you. Now next we'll talk about what are the symptoms of perioral dermatitis. So, perioral dermatitis usually appears as a rash of pus filled bumps around the mouth and in the folds around the nose. The bumps may be scaly in appearance. They can also appear in the area under the eyes, on the forehead, and on the chin. These small bumps can contain pus or fluid, but they may also resemble acne. You may also experience symptoms such as burning, itching, especially as the rash worsens. Now, next we'll talk about is perioral dermatitis contagious? So let's talk about it. So perioral dermatitis is not contagious. It cannot spread from person to person. Okay. Now next we'll talk about what causes perioral dermatitis. So the cause of dermatitis is unknown. Several common triggers can result in a perioral dermatitis outbreak. You may want to avoid these triggers as much as possible. And these triggers can include topical steroid creams, corticosteroid nasal sprays, or inhaled steroids, heavy skin creams such as which contain petroleum jelly or paraffin base, sodium lauryl sulfate, certain makeups and cleansers, having bacterial or fungal infections, experiencing constant drooling, fluorinated toothpaste, birth control pills, and some sunscreens lotion. So these can be the causes which are responsible for perioral dermatitis. Now next we'll talk about what are the risk factors for perioral dermatitis. So risk factors include people assigned female at birth, as they are more likely to develop this condition than people assigned male at birth. Age, with young and middle aged adults more likely to be affected. Use of steroid creams or ointments on the face, exposure to allergens or irritant, hormonal imbalances, and uses of cosmetics. Now, next we'll talk about the treatment. So, what is the ultimate treatment? So, yes, we are talking about the homeopathic treatment for the perioral dermatitis. Let's talk about homeopathic medicines. So, homeopathic medicines are very helpful to treat cases of perioral dermatitis, and homeopathic medicines help to heal the rash and bumps, either with watery content or pus on the skin in perioral dermatitis, in a very effective manner. They also help to control the attending symptoms of burning and itching excellently. Now, the first medicine which you can see here on the screen for the treatment of perioral dermatitis is Netramure. Netramure is a leading homeopathic medicine for treating perioral dermatitis. There appear rash with the bumps around the mouth in cases needing Netramure. Sometimes the bumps are also present on the chin. These bumps are filled with the watery fluid. Pain and burning may be felt in the blisters. Pain is mostly smarting type. These fluid filled bumps may worst and get over with the scalp. And apart from all these symptoms, in a few cases needing Netramure, cracks at the corner of the mouth may be present. Now, second medicine is Apis mellifica. So, it is an excellent homeopathic medicine for burning and stinging sensation in perioral dermatitis. There is a marked burning and stinging sensation in the rashes. Prickling sensation is also sometimes present in the rash where Apis mellifica is indicated. And in addition to this, the rash is very red and inflamed. Swelling is also present in the rashes. It is also highly sensitive to touch. The rash is also intensely itchy most of the time. Sometimes there are eruptions with yellow crust in some of the cases needing this medicine. Now, third medicine is graphitis. This medicine is indicated for sticky discharges from the eruptions in perioral dermatitis. The person needing it has inflamed rash around mouth, along with worms, a rise that oozes sticky, gluey fluid. The fluid is transparent and watery in nature. The bumps appear around the mouth and chin, where graphitis is needed. These bumps also tend to itch and sometimes attended with a burning sensation in them. Next medicine is Rustox. So this medicine is recommended for the fluid-filled eruptions in perioral dermatitis. The presence of fluid filled eruptions around the mouth. These eruptions are mostly present in the clusters in cases needing dustox. These eruptions are filled with a yellowish colored fluid, which is very watery in nature. Itching and biting sensation are present in these eruptions, and most of times, these eruptions are also very sore to touch. Next medicine is Hipersulf. This medicine is recommended for the pus filled eruptions in perioral dermatitis. So these eruptions are also very painful and are very sensitive to touch. Sometimes the heated sensation is also there in the corner of the mouth along with the pus-filled eruptions. Next medicine is Silesia. So this is a top grade homeopathic medicine to treat pus-filled eruptions in perioral dermatitis. It is a great anti-suppurative medicine to treat skin conditions where pus-filled eruptions are present. So cases needing it has marked itching and prickling in the eruptions. The eruptions may be covered with the scabs too. There is also a tendency to sweat excessively in such cases. Now, next medicine is arsenic album. So, this medicine is indicated for scaly and flaky skin, flaky rashes in cases of perioral dermatitis. The affected skin is very dry, rough, along scaliness. The peeling of skin may also be there. It is attended with burning sensation and itching. Scratching worsens the itching in cases needing it. People requiring it usually complains of worsening or burning sensation is at night time. The affected skin is also oversensitive along with all these symptoms. Now last medicine for perioral dermatitis is sulfur. So, homeopathic medicine sulfur is very effective to manage itching. Person needing this medicine mostly have to worsen itching at the night time. Scratching the rash often leads to pain in the affected skin area. Along with itching, they also complain of burning sensation in the rash. And sometimes they have stitching type of pain and prickling sensation in the rash. A formication sensation like insects are crawling on the skin in the rash may be complained by them along with all these symptoms. They may also have fluid or pus filled bumps along with the itchy rash. So these are the homeopathic medicines which has been successfully used for the treatment of perioral dermatitis. So that's all for today. In conclusion, I want to say that while perioral dermatitis can be a challenging condition to manage, but homeopathy offers safe, natural, and effective solution to alleviate symptoms and promote long-term skin health. So if you or someone you know is struggling with perioral dermatitis, I encourage you to consult them right now. So, together we can work towards restoring skin balance and reclaiming confidence in your skin's health and appearance. So, thank you so much for watching, and until next time, take care and stay well. So, if you find this video informative, helpful, and especially valuable, so please give this video a thumbs up and subscribe to our YouTube channel and hit the notification bell for more insights into the world of homeopathy and natural healing. Until next time, take care and see you guys in the next video. Till then, stay safe and stay healthy. And if you are suffering from perioral dermatitis or any other health issues, you can contact us. On the screen, you can see how to contact us. So that's it for now, and thank you so much for watching this.